Every time I bring up the serious life-altering risks of antidepressants, I get pushback, often from other mental health professionals. They tell me I shouldn't talk about these risks because antidepressants save lives. They warn that sharing this kind of information could scare people away from treatments, and that if something happens and they avoid medications because of me, then the blood is going to be on my hands. This line, antidepressants save lives, is used to silence discussion, even when the data from clinical trials tells a different story. And sadly, many people believe it, even without questioning the evidence. Well, that stops today, because today we're going to be looking at the evidence closely. We're going to look at research that actually shows that antidepressants increase suicidal behavior and sometimes cause more harm than doing nothing at all. And finally, we're going to go through all of the different ways that I've seen these medications drive people towards suicide. This is the type of information you won't get for your doctor, but you deserve to know, so stay tuned. So let's go over the history of how antidepressants became associated with suicidal behavior right from the beginning. Well, all of this started back in the early 90s. Prozac had been on the market for 2 years, and quickly doctors were noticing that some patients were becoming unexpectedly suicidal. This led to hearings at the FDA where they tried to look into the evidence at the time, but when they looked at the clinical trials, they found no increased risk between the group that got the drug and the group that didn't get the drug. Unfortunately, because they privileged that type of data against the case reports at the time, they dismissed the risk. And it stayed like that for nearly 15 years, because it wasn't until 2005 when there had been so many of these cases coming up. They were in the news, they were happening all the time, that the FDA opened this up again. And at that time, they looked at 100,000 people who had been in FDA clinical trials for antidepressants, and what they found was shocking. And here's what they found. If you are under age 25, you were 2.3 times more likely to have a suicide attempt if you were on antidepressants than if you were on a placebo. Let me say that again, because I really want that to sink in, because it's kind of crazy. In these 2 to 3 month clinical trials, if you were under age 25 and you were randomized to get the antidepressant, the treatment that's supposed to help you with depression, you were 2.3 times more likely to have a suicide attempt than the group that got the placebo for, nothing at all. That's crazy if you think about the fact that we use these drugs in children and adolescents and people under age 25. Because yes, they can reduce the amount of depression for sure, like the symptoms of depression, like low and sad mood. But if that actually contributes to the outcome we actually care about, which is people not dying, then it makes no sense really to put people on drugs that increase suicidal behavior. So that was what happened to people under age 25. And you might be saying, Josef, well, what happened to the people older than that? Well, here's the other thing that no one ever tells you about. In the group of patients that were 25 to 64, there was no difference in suicidal behavior. And so this isn't exactly saving lives right here. It's neutral. There's an equal number of people trying to take their life in both of the groups. This is not a life-saving benefit in these 3-month clinical trials. And also, to give you the full picture, there was one group where they actually saw the risk decrease at this time, and that was only for people who were age 65 or older, and they had a lower risk. Now, if you ask me, does this clinical trial data, these huge randomized controlled trials where they've looked at hundreds of thousands of people, does this support the claim that antidepressants are saving lives? No, in fact, it doesn't. It supports the claim that for most people, they're doing nothing at all. If you're under age 25, they're increasing the risk. And yes, maybe if you're over age 65, there's a slight survival benefit there. But we act like the clinical trial data simply shows that these drugs, they just save lives. It's so obvious. It's so clear. Well, that's not what randomized controlled trials show. Now, why are there so many people out there who like to dismiss this and they just say, you can't believe that, and they actually do save lives? Well, usually what they're doing is a technique that was common when people were trying to discredit the link between cigarettes and smoking. They will cherry pick data. So they'll grab some, big population level study, and they'll say, well, at this time there were a higher rate of antidepressants being prescribed, and we see like the suicide rate went down. They'll selectively find some of that data and say, look at this correlation, more antidepressants, more lives saved. Whereas these studies, I mean, they may seem credible on face value, but to anyone who knows anything about epidemiology, you'll know how riddled with problems they are. You'll know that maybe antidepressant use, correlates with higher socioeconomic status. Maybe that's protective against suicide. You know that there can be changes in the way coroners do autopsies depending on the funding they're getting, when they can do more or less. And this can influence whether things get recorded as suicides because they, test the people and they find that they've overdosed, or natural deaths. And so these kind of correlation studies that people do at the population level have been used for people to cherry pick and say that these drugs don't cause suicidal behavior. But it is bullshit, because the best data that you are ever going to get on something like this really is going to come from these randomized controlled trials. And if you are seeing, placebo-controlled studies where there is an increased risk of suicidal behavior in groups that are the same, except that one group got the drug and one group didn't get the drug, that blows the other studies out of the water when it comes to detecting a risk like this. And so I want to show you a clip right now about how this message is smoothed over and how academics out there who want to protect the mainstream narrative about antidepressants are essentially going out there and lying to the public. Check it out.
The fact is, Robin, if you look at the whole evidence puzzle from all over the world, it points very clearly in one direction, that medications don't cause people to be suicidal. In fact, it's the underlying diseases like depression that actually leads to people dying by suicide.
So let's move on in this story now and talk about another study. So Mark Stone had done that 100,000 person study back in 2007, 2008. Let's fast forward now to 2019 when Hengartner and Plodel took another look at updated antidepressant studies. So we're talking about 10 years later now. And they were focusing on adults and the number of people who had experienced suicidal events. And what they found was shocking. The actual suicide rate in adults was 2.83 times higher in the antidepressant group. Now, that did not reach statistical significance, but I'll tell you what did reach statistical significance. It was the suicide attempt rate. They found that suicidal behavior was 2.38 times higher in the group that got the antidepressants than the group that got placebo. So now in this study, we're actually seeing that in adults, these drugs are associated with a higher rate of suicidal behavior. And so now that you've seen what's happened in the randomized controlled trials, you might be curious, how do these drugs actually make people suicidal? And what I want to talk to you about is what doctors have been recording in the medical literature for the last 30 years. And I have to tell you, I have seen all of these things in my clinical practice. And so the first one we're going to talk about is disordered emotional control. Some people on antidepressants seem fine most of the time, and they may even feel like the medication is helping them. But when something stressful happens to them, they suddenly react in ways that feel extreme or out of character. Now, before they got on the medication, they would notice that they could pause, they could take a breath, and they could ride out the stress. But when they are on the drug, that pause is gone, and instead, many quickly become overwhelmed and feel impulsively suicidal, even if they were feeling fine just a moment before. And it's as if there's something about the drug that has weakened their emotional braking system. And many people will describe it like this: I just don't know what came over me. That wasn't me. And after the crisis passes, they often feel confused or even shocked by their own behavior. Now, this is really scary because this cannot be monitored 100%. You can't tell patients' families to say, hey, keep an eye on them because they're going to, there is a chance that they could have an adverse reaction. No one can watch someone 100%. You can only do your best. And in a split moment, if something happens and they are having this side effect, it can lead to an avoidable death. And it's tragic. And in fact, this is what I believe was going on with Thomas Kingston, who was a member of the UK royal family who was given an SSRI for insomnia and work stress. He had no history of suicidal thoughts and no plan to end his life. In fact, the days before his death, he was making plans for his future. And then yet, without warning, he impulsively ended his life at his parents' home. The coroner ruled that this drug was the direct cause of his death and not an underlying condition. His parents, heartbroken by the news, have been advocating for signed informed consent because they believe that people would not be taking this drug if they knew that side effects like this could happen. Now, the second way that people can end their lives on antidepressants is through a side effect called akathisia. Now, akathisia is the Greek word meaning to not sit still, and it's a confusing name that we give to this constellation of symptoms. People will feel a few things. They will feel restless. They'll feel like they need to move and pace. The next thing that they feel is severe anxiety and obsessive thoughts, sometimes even very dark, morbid thoughts. And the third thing is that they could start to have some cognitive impairment as well. People often describe this side effect as a state of mental torture, and they want to get out of their body, and they say things like they just need to rip their own skin off. This incredibly unbearable state has led to high-profile suicides, such as the loss of Stuart Dolan, who was a Chicago lawyer, who in a state of akathisia, he threw himself in front of a train. The next way that antidepressants can push people into suicide is through mania. Now, on all of these drugs, they show that in the warnings and precautions section, which is one of the highest areas on the drug label where you warn about the most important risks, it says that they can induce manic behavior. Now, what is manic behavior? Well, it's like you have bipolar disorder. You can become impulsive, you can become grandiose, you can spend a lot of money, you can destroy your reputation by doing things you normally wouldn't do. And oftentimes people can be highly irritable and also depressed during these phases. And when you push people into these terrible states, they can become highly impulsive and suicidal, or they may actually do things in their life that drives them to want to end it. Like if you're depressed and you have a manic episode and you lose a lot of your money and you completely destroy your reputation because you've done things you normally wouldn't do, that might drive you towards suicide, and so mania can be really dangerous. Next up is emotional blunting. Many patients on antidepressants, especially the SSRIs, will describe feeling emotionally numb, unable to cry, feel love, or even enjoy anything. This emotional deadening or blunting can lead to feelings of meaninglessness and detachment from life. Now, while some people may welcome this if they have a lot of anxiety, but it also flattens positive emotions, leaving people feeling hollow and robotic. And some patients say that they become suicidal, not because they're sad or depressed, but because they feel nothing at all. Another way this can contribute to suicidal behavior is that sometimes the anxiety and the concern that you have for other people in your life prevents you from taking your life. You might say, I am not going to take my life because of what it would do to my children or my parents. But if you're heavily blunted out now, that's just not going to be that concerning at all. And we see a lot of suicide attempts where people will take their life and their families will come and say, where is the note? Why didn't they say anything? I suspect in some of these cases, it could have been because they were heavily dissociated and blunted on the drug, and they were not thinking about the consequences that the taking of their life would have on the people around them. The next one is withdrawal-induced suicidality. This hits really close to home because I've actually seen this. I've actually seen this happen for several people that me and my team have tried to help. One of the most horrific things that can happen to someone is a condition called protracted antidepressant withdrawal. Now, if you come off these medications too quickly, you can develop akathisia and a whole range of other neurological problems, gastrointestinal problems, pain, ear ringing, light sensitivity, severe anxiety, all of it. And this state can last sometimes for years. For many people, it's a state that lasts up to 2 years and is very, very severe. Many people will try and take their life when they're in this state, and many will succeed as well. And so it is an incredibly high-risk state when people are hurt in this way. And the worst thing about this is that it's completely avoidable. If doctors would simply taper patients in a slower way, they won't develop protracted withdrawal and they can avoid this. And so, unfortunately, I see many people take their lives due to antidepressant withdrawal. Now, the things that I just discussed with you there, most of them were acute risks that happen, shortly after getting on the drug, aside from the withdrawal stuff. But there's actually a lot more ways that these antidepressants can lead people to take their lives, ways that aren't really detected in the clinical trials. Because remember, earlier on in the video, I was talking about that increased risk of suicidal behavior. Well, that's only capturing the first 3 months of drug use. Now, most people take these medications for much longer than that. In the US, 50% of antidepressant users are on them for 5 years or longer. Now, this is important because there's a lot of delayed risks with these antidepressants that don't turn up in those short-term clinical trials. And I'd like to talk about some of them. Well, The first one is the fact that these drugs cause tolerance. They simply wear off over time. The longer you take them for, the more tolerance builds up. You need to get on higher and higher doses, and eventually people end up on more medications. And so they're not even drugs that are going to work consistently long term. The other thing that I see happening is that people will develop a condition called tardive dysphoria. Now, tardive dysphoria is a state of neurotoxicity induced by being on these drugs long term. Sometimes it even happens after 15 years. People will think they're fine on the medication, they can be on it for the rest of their life, but then they start to develop this state where they feel very disconnected and blunted. They don't feel excited about anything. They start to develop high background anxiety and a small amount of cognitive impairment. And they start to wonder, why don't I ever feel well? And this slowly gets worse the longer they stay on the medication. And then the doctors tell them that they have treatment-resistant depression, and then they start hitting them with more and more medications. Ultimately, this doesn't work because it's not a depression. It's actually a drug problem, and it gets worse and worse. And I've seen people get into terrible states because of issues like this, where they can become very suicidal. And finally, the last issue to be aware of are less common risks such as PSSD, where some people will develop persistent sexual dysfunction, as well as neurological problems like blunting and cognitive impairment because of the drug. And these don't go away when people come off the medications. Unfortunately, because these drugs are studied for this 3-month block and no clinical trials are done longer than a year for antidepressants, we have no idea what the odds are of you becoming tolerant to them in a couple of years and then wearing off, you developing PSSD, or how likely it is that you're going to develop tardive dysphoria. Your doctor doesn't know, the researchers don't know, and you don't know the odds of this happening. And so there are all of these things that happen down the line that can lead to suicidal behavior. And let's not forget one last thing as well. Unfortunately, in America and probably the rest of the world, people use these drugs to just paper over problems people are having, like legitimate things, whether it's life stress, work stress, medical problems, dietary issues, substance abuse. If you just paper over these problems with SSRIs and then accept your doctor's perspective that, this is helping you, that's simply not true. It's just masking symptoms of an underlying problem that will simply just fester and worsen and will make you more depressed and more likely to engage in suicidal behavior in the long run. The only way to get away from that is to actually fix the underlying problem. And so another kind of tangential way these drugs contribute to more suicide attempts is that they distract people away from actually fixing things in their lives that they need to. These drugs are not a long-term solution. They paper over things. That's not a good strategy for fixing things in the long run. Okay, so let's shift gears now. I've done a lot of bashing on the antidepressants, and so we need to talk about the use case scenario for when they are helpful, just to balance things out a little bit. The most important thing that you have to understand is that these drugs work by blunting emotions. And they actually do that. I mean, I've taken Zoloft before I know what it is like. And if you're someone who is highly anxious or distressed and you take a drug that blunts your emotions, you might feel better. In fact, you might even feel like it's protected you from a suicidal event because that anxiety was driving you crazy. And so that's really how they work. And you have to give them credit for this because that is what happens. However, as a long-term strategy, they wear off over time. And so we have to think about, what is this going to be like in the long run? Now, the other issue that's very disturbing about the effectiveness of antidepressants is just that they don't really work that well. For instance, in 2017, Jacobson and his colleagues performed an analysis of 131 trials, and the results weren't great. First, he noticed that in general, the trials had a high risk of being biased in favor of the drug. But when they calculated just how effective these antidepressants were in reducing depressive symptoms, there was an average reduction of just 2 points on a 52-point scale. That is terrible. That is such a small effect. And so that means for many people, these drugs really aren't that effective. Now you have to remember, with these studies, it's like a bell curve, right? And so there's a distribution. There's going to be a lot of people where it's not doing anything. There's going to be a big group in the middle where it's like a 2-point improvement on a 52-point scale. That's kind of negligible and not worth it. And then there's going to be a little group of people on the side who are having much more benefit. Now we simply just have to accept that there are differential effects of these. And so there will be people out there who you encounter who will say, yeah, this drug was really life-changing for me. It had quite a dramatic effect. And that makes sense. at least for the time being, because unfortunately I see these things wear off over time, and it might not be 5 years later, but I've seen it happen 20 years later and such. Here's what I want to say. I think it is incredibly misleading that any time that someone criticizes these medications, they're almost shouted at to say, hey, these drugs, they save lives. How dare you talk about them in this way? You're scaring people away from the medications. That's not true. The data actually shows that if you're put on one of these medications, you're more likely to take your life than someone put on a placebo. And based on all the long-term problems that we see with these things, with these medications, like the fact that they wear off and they make some people more depressed in the long run through tardive dysphoria, I'm highly convinced that that ratio worsens the longer people are on the medications, and we actually see more and more suicidal behavior. A more accurate way we should be talking about these drugs is actually in the converse. It should be when people start saying, oh, I think I want to take an antidepressant. Instead of like clapping your hands and cheerleading them to the doctor's office to get on these things, you should be saying, are you really sure that you want to do this? These drugs, they can make people more suicidal on average than if you were to take nothing. Is there any other way you could fix this? Because the truth is that antidepressants should only be reserved for people who have tried absolutely everything else before getting on them. Unfortunately, many doctors and the public have been convinced by a lie that these drugs actually make people at a population level less suicidal. It's a lie. And so that's it for today. What I want to ask you to do is to hit subscribe and hit the like button for more content that exposes the truth behind psychiatric medications and the real consequences we're not being told about. What I want you to do is in the comments below this video, if you became suicidal because of one of these medications, tell us your story. How did it happen? What was it like? I would love to read about it. And if you want to learn more about the biggest case of this that happened in the last year, check out this video here on Thomas Kingston's drug-induced suicide.